Hi, my name's Aisling and I'm a psychologist in clinical training. And today I'm going to briefly talk about my experience of working in the specialist service in the UK. So I worked at the National Centre for High Functioning Autism at Great Ormond Street Hospital. And this was a national service that offered second opinion autism assessments and consultations to local teams across the UK and was open to referrals for under 18s who are in mainstream education. And it worked really closely with the research team at UCL to help facilitate research to improve the evidence base for autism and assessment of autism. So how do these specialist services work in the UK? So usually when there's concerns around a young person and autism, a GP will facilitate a referral to a local service to assess for autism. However, 1 to 2% of these cases that are assessed locally may then require a further specialist autism opinion. So what type of cases might these be? So it might be that there's a difference of opinion between clinicians or between clinicians and parents. It might be that some of the behaviours and difficulties that are evident at home are then not evident in clinic. And it can be really difficult to tease apart what's going on for the young person and a lack of clarity around diagnosis. Then it comes to differential diagnosis. So it can be really difficult when a child and young person is presenting with a mental health difficulty and there's a query whether there's an underlying neurodevelopmental cause or difficulty associated with that. So we know 70% of autistic people have a mental health condition and 40% have 2 or more. So it can be really difficult to tease these things apart and to work out what's going on for this young person. There can be mental health conditions and difficulties that present similar to autism, such as attachment difficulties, selective mutism, anxiety. So it can be really helpful to have a thorough specialist assessment looking at these things. And these specialist assessments, specialist services, have been set up as they improve the health outcomes of children and young people if they can get access to a specialist assessment and diagnosis, then that can be the gateway to access the correct local services closer to home. So here's just a snapshot of the type of referrals that we've received in. So 45% of our referrals were for girls. The mean age at referral was 12 years old. So typically at the age that the child would transition to secondary school. So these children can be really well supported in primary school. And then when they transition to secondary school, the difficulties can become more apparent. So there's an increase in the need for the child to be more independent, and also social interactions become more complex and demanding. So this is when the difficulties can become more apparent. And a large proportion of referrals were coming from mental health services. So these young people were already presenting with mental health difficulties. So then moving on to the assessment. So parents and school will be sent out questionnaires and screening tools to assess for autism, mental health difficulties, learning difficulties, just to establish what may be going on for this child and to help guide the assessment. And parents will then be invited in for a 3DI, which is a really in-depth diagnostic developmental interview, which is computer-based. And then the child would be invited in for an ADOS to look at their social communication, a cognitive to look at their learning, and also more often than not, a school observation. So to see this child in a more natural environment than the clinic, to see them during structured periods such as classes, unstructured periods, so between classes, moving between classrooms or break time, and also seeing how they interact with their peers. And usually have a school meeting at this point to find out a bit more from school what may be going on for this young person. Following this assessment, there'd be feedback for the parents and feedback to local services and advice given around what would best suit this young person and what services they should be accessing. And then also there'd be a school consultation, so providing individual advice around this young person to really help them thrive in the school environment. So this leads on to the difficulties that we saw in assessing girls. So we know boys are 4 times more likely to receive a diagnosis of autism than girls. And because of this, research historically has focused on understanding autistic males. So it's been very biased. This is evolving now, but the standardized tools that we use for assessing autism have yet to catch up. So there's an inherent gender bias in the tools that we're using during assessment. So we know girls are less likely to come to the attention of services and to be diagnosed unless they have additional difficulties. So that could be intellectual difficulties or mental health difficulties. We know as well that girls are more likely to be diagnosed later than boys, which means that they may have learned to cope in social situations through mimicking and masking their difficulties, which then can be difficult when it comes to assessing and trying to understand what may be going on. So these are the four main areas of difference between autistic girls and autistic boys, and this comes from clinical practice and from research. So really thinking about how can we correct this gender bias in the tools. So we know social motivation, that autistic girls are more socially motivated and more likely to put more effort into establishing friendships. However, they may have high levels of conflict within these friendships, but they're more socially motivated than autistic boys. When it comes to restricted and repetitive interests, so girls are more likely to have strong interests that are relational, that are involved in developing relationship with others. So these others may be celebrities or pop stars or animals, which are not uncommon interests for a teenage girl. However, the narrowness and intensity of these interests can be unusual. When it comes to repetitive and stereotype behaviors, such as hand flapping and spinning, so girls are much more likely to camouflage these difficulties. So in order to fit in and to not risk social isolation, they learn to mimic or to mask these behaviors. So you're less likely to see these behaviors. And then girls are much more likely than boys to experience internalizing difficulties. So that's anxiety and depression, whereas autistic boys are more likely to experience externalizing difficulties, such as behavioral difficulties. Thank you very much for listening, and I'll pass you over now to Niamh, who's going to talk from the adult perspective.
Hello, my name is 𝘠𝘩𝘬𝘬 and I'm a clinical psychologist in training at the University of Limerick. Like Aisling, I've gained both clinical and research experience in the UK, and my brief talk will cover some of the reasons that someone may seek an autism assessment as an adult, some of the more common presentations in women seeking an autism assessment, some of the challenges that clinicians can face when assessing for autism, as well as addressing some of the reasons why there may be a delay in assessment and diagnosis. So for some people, the function of an autism assessment is to seek diagnostic clarity, whether that be to gain a second opinion or to have other diagnoses re-examined. For others, coming into contact with the criminal justice system may be what prompts them to seek an assessment. Knowing that someone is autistic can have considerable implications for their sentencing and may impact on where they may be placed and what type of facility that they may be placed in. For other people, it may be the experience of having a child or a family member receive a diagnosis that prompts them to undergo their own assessment. For autistic women, it's common to hear experiences of burnout, particularly following social interaction or engaging in social activities, also feelings of being different, different to peers, different to family members as well, which can be a reason for seeking an assessment. And for some other people, it can be difficulty in forming and or maintaining romantic relationships. So there are many reasons why there might be a delay in seeking an assessment. In fact, some of our speakers have touched on this in their talks. Firstly, it is important to note that our collective understanding of what autism is has changed considerably over time. As a result, the criteria to meet the diagnostic threshold has also changed and continues to expand. Both on an individual and societal level, we are becoming more aware of what autism is. However, there's still certain stereotypes that are presented and perpetuated in the media which can be unhelpful and damaging. Changes to diagnostic criteria and increased awareness have helped us to identify autism better. However, there has been a lost generation of autistic individuals whose autism remains unidentified or detected. With respect to autistic women, there is evidence to show that women are more likely to internalise their difficulties, and in turn it may take them longer for them to be identified as autistic. As clinicians, our role is to identify autistic traits, characteristics, and behaviours across the lifespan. So it's important to get a very detailed early developmental history. However, in adult services, that's not always possible, and that can prove a challenge for us. For many people seeking an autism assessment, they may also have other co-occurring conditions, and it's very important to have a team of skilled clinicians involved in the assessment of autism to definitely identify autistic traits if they are present. Also, for many autistic people, they have formed adaptive strategies, and this can be referred to as camouflaging or masking of core autistic traits. And therefore, for clinicians, it's really important to recognise and understand these strategies as they can, as it'll help inform our assessment. So I've briefly covered quite a lot in that talk, and if anyone would like to ask any more specific questions, please feel free to do so. Thank you.